Hello, my name's Dr. Shah. I'm one of the directors of Medlighten Medical Education. This video is about what to do if you have a patient in your medical exams who wishes to self-discharge and the 4 steps that you should follow. Step 1, try and persuade your patient to stay. Step 2, if you can't persuade your patient to stay, explain the ultimate risk or the worst case scenario if they were to self-discharge. Step 3, assess their capacity. Step 4, give them a self-discharge form and explain what to do if they change their minds, offer safety net advice. So how would we put this into practice? We would say something like, Mr. Smith, if you were to go home today, then my concern is that there's a chance things could become worse and this could become potentially life-threatening. So you need to be honest about the ultimate risk. And actually, if you think there's a high chance the patient would die, you would phrase it like this. You would say, Mr. Smith, if you were to go home today, my concern is that there's a significant chance that this could become life-threatening. If they still wish to go, then you need to then assess their capacity. So you would say something like, Mr. Smith, I just want to make sure that I've explained myself clearly. So would you mind repeating back to me what I've just explained? And then if you have assessed their capacity and you've ascertained that they do have capacity, then you would offer them a self-discharge form and you would say, Mr. Smith, if you do change your mind once you get home, then please contact your GP or 111 and they can certainly refer you back to us. And you might offer suitable alternatives. So for example, if they're having intravenous antibiotics, you may wish to speak to your senior to see if it would be possible for them, for example, to have intravenous antibiotics in the community. So that's what I would do if a patient wishes to self-discharge. 1, try and persuade them to stay. 2, explain the ultimate risk and be honest. 3, assess their capacity using the phrase, just to make sure I've explained myself clearly, because this is a nice, polite way of checking their understanding without sounding patronising. And 4, offer them an alternative. Make sure you've given the self-discharge form. Tell them what to do if they change their mind.